Good day, everyone. So, I hope you have been enjoying our lectures. This is the concluding part of our lectures. Today, we'll be looking at the management of diabetes during Ramadan. We'll be following this outline, the dietary management, exercise, and medication adjustment. For dietary management, it's important for a diabetes patient to know that the period of Ramadan is not a period that you should be eating a lot or eating high sugar content food, but is the period to maintain that diabetic portion control. So this picture shows you the diabetic portion plate where quarter of the plate should be grain, preferably whole grain or any other tuber. The other quarter of the plate should be white meat or lean meat. Half of the plate should be vegetable. And if a diabetes patient is to use oil, it should be vegetable oil and less of oils that have a lot of saturated fat. So, as I earlier said, the diabetes patient should observe portion control. The diabetes patient is allowed to eat 3 times at suhoor, at iftar, and later in the evening. Diabetes patients should stay well hydrated because those who stay in the tropics during Ramadan is usually hot and there is risk of severe dehydration and shock. So take a lot of water during suhoor and iftar. Avoid fried foods. Fried foods have more calorie and have trans fat and may have cholesterol oxidation products, putting diabetes patient at risk of heart attack, stroke, and other problems. So it is important to avoid fried foods. Preferably, it should be cooked or boiled food. Diabetes patients should avoid refined sugars like soft drink, table sugars, and other refined sugars that have high glycemic index and high tendency of elevating their blood glucose levels. You should also avoid compensatory feeding. After staying, especially those in West Africa, after staying between 11 and a half to 12 hours without food, there is tendency that one may want to eat excessively. If you do that, there is risk of hyperglycemia and you may come down with hyperglycemic emergency. So it is very important not to eat excessively during iftar. It is preferable that diabetes patients should not skip suhoor. Because diabetic patients have reduced amount of glycogen store in their liver and they are prone to hypoglycemia, so they should take suhoor and should take it as late as possible, not early. That will ensure that risk of hypoglycemia is reduced. So for the exercise, it's very important that during this period diabetes patients should avoid vigorous exercise, because vigorous exercise, if the control of the patient is poor, there's risk of diabetic ketoacidosis, especially in type 1 diabetes. If the control is good and you engage in vigorous exercise, there's risk of developing hypoglycemia. So vigorous exercise is not advisable. Light exercise such as walk after the patient has observed if tired and unrested can be observed. But if possible, it is very important to check your blood glucose for the diabetes patient, to check his or her blood glucose. So this is one of the treatment plan that you give your patients as a health professional. So they should always check their blood glucose before and after exercise. Like if the blood glucose is already 4 or 5, the diabetes patient is advised to take something before beginning the exercise, because at that level there is risk for hypoglycemia if he or she go ahead with the exercise without taking anything. So for medication adjustment, this is extremely important because diabetes patients are not advised to take the medication the way they used to, especially those who are on strong medications that can easily cause hypoglycemia. So for metformin, if it is one daily metformin dosing, no adjustment needed. Patient should take it at iftar. If it is twice daily, patient can take it at suhoor and iftar. If it is 3 times daily, the morning dose is maintained, while the afternoon and evening dose are taken at iftar. For those who are on sulfonylurea, it is advisable that the sulfonylureas be changed to glycoside MR and glimepiride. If possible, avoid glibenclamide during Ramadan fast. So for those who are on once daily sulfonylurea, you should take it at iftar. But the dose can be reduced or sometimes skipped if the patient already has good glycemic control. As we discussed in the first lecture, fasting tends to reduce the blood glucose. So the once daily sulfonylurea can be reduced or even skipped. If a patient is on twice daily sulfonylurea, the evening dose can be maintained, while the morning dose can be reduced or sometimes skipped. So for those who are on combination therapy, especially combination therapy that contains sulfonylurea, it is advised that if it is one daily, you can take it at iftar, and you should reduce the dose by 50%. So you can take half of the tablet. But if it's twice daily combination therapy, like those who are on metformin sulfonylurea combination, then you should skip the morning dose and take the evening dose during iftar. But some individuals are on metformin, single plain metformin and combination drugs. Sometimes they take it metformin with sulfonylurea in the morning, then metformin alone at night. So in this case, you can either stop, depending on the control of the patient, stop the metformin and take the combination drug in the evening, or just take the metformin both morning and evening. That's at suhoor and iftar. For those who are on insulin, especially premise insulin, you can switch the dose, in which the evening dose becomes the morning dose and vice versa, and the morning dose should be reduced by 20 to 50%. For patients on long-acting insulin, you should take it at iftar. For those who are on multiple insulin injections like basal bolus, maybe the basal is 3 times a day, maybe the bolus is 3 times a day and the basal at night. So for the bolus, you should skip the afternoon dose, and the other injections you can maintain it by giving it at suhoor, and the suhoor dose should be reduced. Then the evening dose should be maintained, and you can also give the long-acting in the evening. That's especially for type 1 diabetes patients that are on multiple insulin injections. So, but for DPP-4 inhibitors like sitagliptin, vildagliptin, and other DPP-4 inhibitors, no change. You can take it, if it is one daily, just take it at iftar. The same is the case for thiazolidinediones. Also, no need for any adjustment. However, those who are on SGLT2 like dapagliflozin and pagliflozin, there is need to be cautious, especially those who are living in the tropics where the weather is very hot during Ramadan, because it has diuretic effect and patient can become dehydrated. So you take a lot of fluid when you have the opportunity to at iftar and suhoor. So this is the end of our lecture series. I hope you enjoy the lectures, and it's advisable that this is the time that you review your patient properly, detailed history, you do the risk stratification, cancel patient as appropriate. Those who should be fasting, should be managed in terms of the diet, the exercise, and medication adjustment as appropriate. So I want to thank you for going through all the lecture series. I hope that it will help us in the management of our patients during Ramadan fast. Thank you.